everyone, to the SimMan Critical Care Product Showcase. My name is Tracy Mulcahy, and I am the Product Marketing Manager for our Medical, Emergency, and Trauma portfolio. I've been lucky enough to work at Laerdal for 10 years. For the first 8, I was the Senior Client Executive for the New Jersey territory, and then I recently transitioned to my role here as a Product Marketing Manager in all things SimMan. I am very happy to have a co-host today in Bruce.
Hello, everyone. My name is Bruce Garrettoglu. I'm a respiratory therapist. I'm also the manager of technical and educational services here at Laerdal Medical Canada. Really looking forward to this presentation today.
Bruce and I are so excited to bring you the SimMan Critical Care Product Showcase. We had a little help. So we have 2 amazing colleagues in Norway, Danny Bielitz and Carl Rubin, who are going to walk you through some amazing features and functions. But Bruce and I are going to be here to highlight some of those literal critical features and applications for you along the way. So we're so happy to have you, and I'll turn it over to Danny and Carl Rubin.
Hi everyone, and welcome to today's product showcase, What's New in Simulation, where we're going to take a closer look at our latest solution for advanced training, the SimMan Critical Care, which has been designed for use in respiratory and critical care scenarios. My name is Danny.
And my name is Carl Ruben, and we will be your hosts today.
The purpose of this product showcase is to introduce SimMan Critical Care and to demonstrate the unique features now available to learners and healthcare teams. The product is designed to cover all aspects of medical training from basic through to advanced scenarios. Today we're going to talk about the benefits of this type of training and show you some of the key features and added functions. We'll have time at the end of the session for questions and answers, so please feel free to use the Q&A features at any time you have a question. So let's talk about why this product is an important part of our portfolio. Chronic respiratory disease is the 3rd leading cause of death globally, responsible for approximately 4 million deaths each year.
Yeah, and the deaths in respiratory illness necessitates specialized training that provides healthcare teams more opportunities to acquire the advanced skills needed to care for critically ill patients.
These numbers really surprised me, especially as an RT. It's hard to believe that chronic respiratory diseases, or CRDs, are the 3rd leading cause of death globally. Also, 1 in 20 people suffer from CRDs around the world, and deaths due to CRDs have increased by 40% since 1990. This is due to a number of different causes. Obviously, population increase, environmental changes, just to name a few. And these CRDs aren't curable. And then from time to time, people who do have these conditions and people who might necessarily not have the conditions, but may require really complex ventilatory interventions when they're in hospitals, require teams of people, and especially respiratory therapists, that are experts in these fields.
Yeah, Bruce, I actually have a personal story that I'd like to share with regards to team training around ventilation. Earlier this year, my father fell ill and had a stroke. And he had brain surgery. And when he came out of the brain surgery, of course, he was completely supported on a ventilator. And within, normal time frames with having a stroke, he started to, come out of the anesthesia from the surgery and started to breathe on his own. And I was very lucky that I had an incredible team of an ICU nurse, an ICU physician, and a respiratory therapist that were caring for my father. And so as my father was waking up, it was painful to watch him trying to take breaths outside of that ventilator. So his ICU nurse was trained well within ventilator management, was able to recognize the alarms, and then at that time made the decision with the ICU doctor to call respiratory therapy. I became very close with Debbie as she was caring for my father, and basically to watch them care for him and allow him and give him time to be able to recover. And then the communication and the teamwork between two ICU nurses, the respiratory therapist, the ICU physician, to be able to do the extubation. It was very heartwarming to watch. Unfortunately, the outcome for my dad wasn't what we wanted it, but it certainly wasn't because of the care. But what they were able to do in this team was work together as one and get my dad off the ventilator so that we were able to spend some quality time with him. And it'll be something that I will never forget. And as working with SimMan Critical Care, it just really brings to the forefront how important that segment in a patient's healthcare continuum is and how important that training is to be done.
Ooh, thanks for sharing that, Tracy. I mean, this is an example of an expert team who have trained together, can have a positive impact on you and your family. Unfortunately, the outcome wasn't what you had desired, but it is with tools like SimMan Critical Care where we can help train not only experts, but we can help train expert teams as well. So thank you. Let's move on to the next segment of our presentation. This is a segment where Danny and Carl Rubin walk us through SimMan Critical Care as a foundational tool to help with simulation activities. And then they also speak about how you can layer different layers of sophistication on SimMan to achieve your very specific learning outcomes. So we'll turn it over to Danny and Carl Rubin.
These opportunities for advanced learning include many of the same features we see today with the SimMan 3G Plus.
Well, then perhaps, Carl Rubin, perhaps you can take us through some of those same features.
Sure. Yeah, absolutely. So I guess one of the main things that's carried over is the advanced airway. It has a lot of options and possibilities to do manipulation of the airway to create different levels of difficulty for the learners.
So these are things like trismus and tongue edema and pharyngeal obstruction.
Exactly correct. Yeah.
What about on the chest, Carl Rubin? What can we see on the chest?
So obviously you can see the spontaneous breathing, so you can see chest movement, and we're also adding the defibrillation here. So on this version of SimMan 3G Plus, you see the live shock. It can easily be converted to studs, so you can use training equipment for it. So either a live shock or a training defibrillation method. So up to your choice, really.
And we have sounds and those sorts of things, both anterior and posterior?
That's correct. So there's a magnitude of speakers to create the different lung sounds. There's also heart sounds, like before, and there's bowel sounds. Okay. So you can do different types of auscultation.
So things like eyes and fluids?
Absolutely, it still carries over. We have fluids in the eyes, as you mentioned. There's also cerebrospinal fluids from the ears. In addition to those clear fluids, there's blood, so there's bleeding from different ports on the mannequin. It also includes the addition of adding a trauma leg that can create more traumatic scenarios with an amputated leg, so you can use a tourniquet. And those types of things. So, yeah.
And I guess with like the real airway and those sorts of things, you know, and obviously ventilation with this particular mannequin, things like real monitoring, because we have the same real monitoring that we have.
Yes. So there's also improvements when it comes to the real monitoring on SimMan 3G Plus. So now we have the capability of using a real clinical device for NIBP. So you can attach your standard equipment. Same goes with SpO2. So you can attach the probe on the finger and get the real reading from a clinical device directly from the mannequin. Yeah, okay. So it carries over a lot of the good stuff from the 3G as we know it.
Fantastic. SimMan Critical Care provides a comprehensive critical care training by incorporating a whole range of different components. Some of the ones I like to talk about now, Carl Ruben, are things like ultrasound, so point of care ultrasound, and I guess also real patient monitoring, which I know we sort of spoke a little bit about earlier. So if we talk about ultrasound first, so we have a product called the Laerdal SonoSim Ultrasound Solution, and this is a product that's co-developed with our partner SonoSim. And one of the things that we wanted to do was sort of include ultrasound as an option to be used within the simulator. And of course, we know this simulator is used for things like trauma. It's used for cardiac related, but also critical care scenarios. So we actually have bundle packages of various scenarios that contain both LEAP scenarios that actually control the simulator, but then also ultrasound cases that are actually displayed on a simulated ultrasound machine, which is actually a laptop.
So then you would have scenarios that would fit different, physiological landmarks or places
absolutely.
in the body?
So say, for example, trauma, if we talk about that just briefly. So EFAST is probably the most common ultrasound protocol for that, where a number of windows are actually taken through the body, and the sorts of things we're looking for is obviously things like, are the lungs working? Is the heart working? Is there any blood pooling around the areas? So we have we have a simulated ultrasound probe that gets placed basically in these locations where you typically would do these particular things. And if we just have a look there, you can sort of see a mark on the skin. Now, we need a mark there because we need them to obviously put the probe on that particular mark, but we don't want it to be visual all the time. So when you are doing ultrasound, yes, you do need to look for it and then place on. But then we're actually using real ultrasound images. So when you actually move the probe, you actually manipulate the image.
And how does that correlate with other functions, features on the mannequin?
Yeah, well, I guess one of the things was really about creating flexibility. So although we use real ultrasound images, obviously those ultrasound images were sort of recorded at a particular rate, as an example. But what SonoSim have managed to do is actually been able to make LEAP able to control the ultrasound images. So as we increase the heart rate in LEAP, or the respiratory rate as an example, we will actually see the ultrasound images reflect that rate. So you actually see them speed up and also slow down.
That's pretty nice.
It is. It's very nice. And of course, so things like in the chest, we see the lungs sliding. But the other thing too is that also when we sort of look in the actual upper quadrant windows, you actually see the diaphragmatic movement as well. So where we see the diaphragm move with breathing, we'll actually see the liver, as an example, moving with that. And of course, all of that is sort of based on the rate. So we have 30 cases in all that actually go through trauma, critical care, and also cardiac. And the critical care scenarios are things like sepsis, they're things like aortic aneurysm, and then cardiac ones are things like murmurs, flutters, pericardiocentesis, where we get swelling around the heart. So that's fairly comprehensive. So that's the ultrasound. The other thing, just to build on what you were saying a little bit earlier in regards to, he has the ability to be able to display real monitoring things like SpO2 and NIBP. If he's being used in a critical care setting, customers might want to actually use more parameters, and the sorts of parameters I'm talking about are things like CO2, are things like invasive lines. So one of the other complementary products that actually sort of works well with his existing functionality is the VitalsBridge 4, which is developed through our partners at Dynasthetics. And what they do is they actually take digital parameters, so the settings that are in LEAP, and then they run through the VitalsBridge 4 and actually convert those parameters into something that a real patient monitor can read. So when you change things like SpO2 or blood pressure, those sorts of invasive lines are available. I guess the thing to mention here is that VitalsBridge isn't available in all markets, but please just contact your salesperson to find out if this is something that actually is available to you. So we've covered a lot of information. So Carl Ruben, perhaps you can tell us how customers can tailor these options.
Absolutely. So we've received a lot of feedback and discussions with many of our customers, and there is a desire, obviously, to have the ability to customize and make the product suit your specific training needs in a more in a better way, really. So allowing customers to train the way which is appropriate for them. So, yeah. So
what they'll be able to sort of, I guess, have their SimMan prepared
Yeah, so let's call it a configuration option. So SimMan 3G Plus is modular to a sense. So as I mentioned previously, this version is with a live shock skin, right? So you can see the discs that indicates that this is a live shock, but you could easily choose the stud skin that allows for training defibrillation. So there's two options in that. The same two options would be available for arms. So you could choose the current arms, which are the articulating arms with real clinical features like non-invasive blood pressure measurement and SpO2. Or you could choose the more standard 3G arms that has the drug recognition feature or the manual blood pressure measurement with Kortikoff sounds. So there's two arm options. In addition to that, obviously there is a interchangeable face skin. So it allows to kind of change the expression of the mannequin. There's the young male, there's a female head skin. We have a geriatric head skin. And obviously you can choose any 3 skin color that you see fit. So torso skins can be exchanged, arms can be exchanged. You have the option to change the look of the mannequin. And these are all bundles that are available for SimMan Critical Care.
But I guess the unique thing about this is, I guess previously he came as out of the box without that choice. You would have to buy those things in addition.
That's correct.
So what you're saying now is that our customers with this particular product will be able to select those options.
That is exactly correct. So there will be choices when you order the product to choose between those options we mentioned now, and it will give you the exact components you want for your mannequin.
Well, that'll create a great deal of flexibility for our customers. Thanks for sharing that.
No worries.
So it's so exciting for SimMan Critical Care that we're able to bring you modularity. You're able to choose the components for which that you want that best meet your learning objectives. So not only do we have 3 skin tones in our light, medium, and dark, but you also have the ability to choose your defibrillation skin, either live shock or defibrillator studs. And you also have the option of arms, articulating arms that have IM injections and IO ability, along with the ability to use your own blood pressure cuff and SpO2 monitor. You also have the ability for manual blood pressure arms with radio frequency. So we're really excited about the ability to choose some modularity pieces that best fit your learning needs. We also have the ability to add on ultrasound with our SonoSim solution and also use your own patient monitors. So practice like we practice, using your individual patient monitors using VitalsBridge. So it's really exciting that you get to really use that practice like we practice module and meet your individual learning objectives and goals. I'll now turn it back over to Danny and Carl Rubin.
So I guess what makes this product unique is actually the advanced lung module. And of course, the advanced lung module was something we produced, I guess, in partnership with our partners Ingmar, who are experts in ventilation training.
Yeah, so basically the same functionality as provided in the ASL 5000.
Yeah, I mean, it's very much the same sort of options as far as, you know, the ability to control resistance and compliance and also muscle pressure. But I guess the unique thing is the actual ASL 5000 functionality is actually within the simulator itself, and of course is merged with all the simulator's functionality. So I guess one of the key benefits about this is that, you know, the mannequin remains tetherless. And of course that was always one of the drawbacks with the ASL 5000 was the fact that it needed, you know, its own power and those sorts of things. But of course the advanced lung module is ran by the simulator. It's also powered by the simulator. So there are no cords. So we can basically pop him on a stretcher and sort of run him through the hospital and sort of run our simulations wherever we choose fit. But I guess one of the key differences, if we talk about the actual two differences, it's really about the tidal volume.
Right.
So the ASL 5000 has sort of 2.5 litres of volume. Because of the size, he has 2 cylinders at 400 mils in each, which means a total volume of 800 mils, which is certainly adequate.
I guess it's on par with what's needed for clinical relevant scenarios.
For an actual adult this side. But I guess, one of the things now is that I'd actually like to be able to sort of show you the advanced lung module in action.
Through collaboration, we are greater than the sum of our parts. And that couldn't be truer when discussing the collaboration between Laerdal Medical and Ingmar Medical, who have really established the gold standard for ventilation simulation globally. Through a decade of collaboration to bring realism to the ventilatory mechanics of our higher, more sophisticated simulators like SimBaby, Nursing and Simulator, and our SimMan family. With the introduction of SimMan Critical Care, which is now a completely portable, all-on-board solution, there is still space for solutions like the ASL 5000. So the fact that we've got these options now offers maximum flexibility and options to our customers and end users. So once again, let's turn it over to Danny and Carl Rubin as they take us through a product demonstration. And please, while they're going through it, don't forget to drop your questions into the Q&A chat.
So welcome back. I hope you enjoyed the video. Just while you were watching the video, we've made some changes to the SimMan Critical Care. So now he is intubated. We have a Thomas tube holder just holding that tube in place. We've connected a suction line and we have him connected to the circuit and then connected to the ventilator. Over on the left-hand side here, we have the LEAP interface that also contains the controlling software for the advanced lung module. And I think for those people that aren't familiar with the ASL 5000, I think it would be best to start there. Now, the guys will be showing the screen, so you'll be able to see exactly what I'm seeing. So on the left-hand side, what we're seeing here is the lung control module. And then on the right-hand side, we actually have the control of the simulator itself. So just to start off, I guess, with the quick choice window, we can sort of see we have this carousel. And if I just click on the different conditions, you'll see them rotate around. Now, these are preset conditions. And once you actually select one, that particular lung model will be loaded and you'll be able to go from a low to a high in severity. So you actually have some adjustments that can be made there. I guess many of our customers like to sort of run things on the fly and actually create their own lung modules. So up the top, we have the advanced lung module control. So if I just select that, you'll see resistance and compliance. These are probably the most commonly used parameters when we're sort of driving, because there's obviously a lot of conditions where resistance and compliance or those issues with the lungs need to be demonstrated. The way that we adjust those settings is I can either grab this line with my cursor and just sort of move it around. Or if I go to the compliance, I can just go to a value, say, for example, 100, and click on that and it would automatically go there. The next tab across the top is the ASL breath effort control. This is probably one of the most exciting ones to use with this particular simulator because muscle pressure actually controls the patient's breath effort. So when we talk about the patient being weaned off a ventilator, we actually control his rate of breathing. So we have a range there and you move these exactly the same, and we also have the ability to select the rate. In the advanced, if I just move that tab across, you'll see you actually have more additional parameters that can actually be set. And these are probably more advanced pressures, but they're certainly important when it comes to setting your own particular lung model. So if you want to create certain lung conditions, you can then set these. And then once you've actually set those to the selections that you wish, when you come back to the quick choice menu, if you select Save Current Lung Model, you can actually enter a name, select Save, and then that will be available for you. Now, there's no limit to the number of lung modules that you can actually create, lung models that you can create. And of course, the nice thing about this is they're available to you at any time. So you can just bring them up by selecting Custom Lung Models. You can import them. You can select them from the list. So that's the software, and I know that's a fairly sort of high-level overview, but let's now make our way over to the ventilator. So right now, we've got it in a pressure support mode. We can see that the orange indication here on a Draeger, these are spontaneous breathing, so the simulator is breathing on his own. We're moving a tidal volume of around 486, and he's currently being supported on this particular ventilator with the setting of 10. So if I just now reduce that, and let's take away the support of the ventilator, one of the things that we'll notice is we'll see a drop in tidal volume. So we're starting to see that now. And of course, this is in direct relation to his muscle pressure that I spoke about on the software. So if I go over to the software now, and then increase his muscle pressure, I can actually correct that on the ventilator. So now we're seeing an increase in tidal volume. We had a low minute volume alarm, which will resolve itself shortly once it's registering his own breathing. And of course, why this is important is to have these sorts of controls is that if we're doing a weaning scenario, one of the things that we're actually able to do is we can either change the settings within the actual software, so adjust the actual advanced lung module, or this can be managed on the ventilator. So what we do on one software has a direct result. And of course, we can also use the other mannequins features as well. So perhaps what I'll do now is invite Carl Rubin back, and what we'll do is take you through a scenario where we're going to actually extubate the patient. So that we've done a pressure support trial, and then we're going to go through the process, and I'll just highlight some of the features of the mannequin that can be used as a part of the assessment process before we extubate. Okay, so I'm going to get Carl Rubin to join me back on the set. And for this particular part, I think, Carl Rubin, what we're going to do is actually go through, just to sort of walk through the steps of a patient who is being weaned.
Yep.
So he's done his pressure support, his spontaneous breathing trial, and that's been okay. And we can sort of see on the ventilator there that he's moving good tidal volume, and there's no support being supplied by the ventilator. So I think we're okay to sort of remove the tube. But I guess we're just going to go through the steps. So this isn't sort of a scenario, so we're not going to wear gloves or anything for this. But what we will do is sort of just walk through the steps of extubating a patient. So I guess the first step, Carl Rubin, if you want to just sort of assess the chest for me, maybe have a listen to his lung sounds. So I think, one of the things to sort of mention here is that we've spoken a lot about the actual lung module and how it interacts with the ventilator. But I guess the key thing to sort of consider here is that the mannequin also has a whole range of features. So things like sounds, eyes, airway, that can all be incorporated and sort of add value or add additional things.
So lung sounds are clear?
The lung sounds are clear? Okay, great. Perhaps now if you'd like to just go through the process of just suctioning the airway, so let's just make sure that there's no secretions.
I'm inserting the catheter.
And of course, one of the things that we can do here with the software, we want to simulate things like secretions. We can increase the respiratory rate, which is going to affect the volumes and those sorts of things. So there's a number of things that we can do in the software to be able to do that. So
doing suctioning.
Yeah.
Okay.
Okay, good. And we've just got a low minute volume alarm, and that's because you've sucked some of the air out of the patient. So perhaps now if we do a cuff check, so if you just release the air in the cuff.
Will do.
Okay, and now that that's done, one of the things we'll notice on the ventilator is it will start to pick up a leak. You should be able to hear the air escaping.
Yeah, I can hear it and I can feel it.
Okay, great. So now we can sort of see we're displaying a leak on the ventilator. We've also got a dropping minute volume because we're losing volume. So I think he's ready to be extubated. So perhaps if you remove the Thomas tube holder now. That's good. And we'll just get the patient to take a deep breath and then you're right to remove it.
Okay, removing. All right.
And of course, the other sort of features that we can use is obviously things like the sounds. So I guess that was just a sort of a relatively straightforward example, but I'm hoping that you can sort of see by using the things that we showed you in the software, the ability to sort of change up the scenario so you could make it more challenging so it's not so straightforward. But things again, eyes, trismus, sounds can all certainly add value to the things that we're doing, not just using the lung module itself.
Wow, SimMan Critical Care software interface is really powerful. Between the lung module and the LEAP platform, it really does give you the ability to recreate and simulate any critical care disease state. I want to bring specific attention to the lung quick choice carousel, where you can easily go from normal to COPD, asthma, ARDS by just turning that carousel and applying the disease state. But I also wanted to bring to your attention the power of customizing your own lung modules. So you have the ability to use the foundation of the carousel, but then you have the ability to go in and really change the lung mechanic parameters, things like resistance, compliance, and muscle pressure. And then you're able to save those changes and name your custom lung module so that anytime you go back into the software, you're able to pull up that specific custom lung module, which really gives you the ability to meet your individual learning objectives and create the best simulations for your teams.
That's right, Tracy. And the more that I work with SimMan Critical Care and the more feedback that we hear, the more we're convinced that in the case of SimMan Critical Care, we're ventilating to the condition of the patient, not to the limitation of the simulator. What I mean by that, just elaborate a little bit here, we can use almost all modes of ventilation, everything from mandatory volume control, pressure control, modes of ventilation, all the way through to support modes like CPAP and pressure support. SimMan Critical Care also supports the training of a wide number of healthcare practitioners, including folks working in EMS, respiratory therapy, critical care, and anesthesia as well. And then finally, SimMan Critical Care supports training in a number of different settings, like in the field, in the case of EMS, in the emergency department, in the operating room, and of course in critical care ICU. So it really is quite a versatile and extremely realistic solution for those working in the areas that require ventilation and ventilatory management skills. Let's move back to Danny and Carl Ruben for their Q&A session. And once they're done, we'll come back and answer your questions live. Be sure to pop them into the Q&A.
Well, that brings us to the end of this product showcase. And you've heard a lot about SimMan Critical Care. We've spoken a little bit about the partner products, and Carl Ruben, you spoke a little bit about the flexibility and configuration for our customers. And of course, we finished off with that demonstration.
Right. And while we were talking, I see we have a few questions that we'll take, obviously. But feel free to ask additional questions or comment in the chat box. Our team will be monitoring and they will be addressing any questions you might have. And I think I'll just ask the questions to you, Daniel, right?
Yeah, sure, absolutely.
So we have one asking about ventilators and asking about compatibility with different brand ventilators. Are there any restrictions here?
No, actually, the advanced lung module actually becomes the lungs of the simulator. So the mechanical ventilator that's used has no impact on the lungs themselves. So at the end of the day, any vendor's ventilator will definitely work with this particular product.
Yeah. We also have one asking about compatibility with the Lucas device, because obviously before SimMan 3G has been compatible with it. Does the lungs change this in any way?
Yeah, I mean, definitely we have a new lung module, but it was important for us to make sure, to obviously maintain the same features and benefits of the existing SimMan 3G Plus for SimMan Critical Care. So SimMan Critical Care is compatible with.
I guess I should also say, for those that are not familiar with the Lucas device, it's obviously a automated compression machine, right? So, yeah. But yes, still compatible and no issues with that. We briefly touched upon the CO2 capabilities in VitalsBridge 4. Could you elaborate a bit more on that?
Yeah, sure. I guess even when we first sort of showed this product at IMSH, we had a lot of questions about it's great that we have the lungs and the functionality and those sorts of things, but is there a way that we can show CO2 without a VitalsBridge 4, as an example? And this is something we're actively exploring. And it's something that we would certainly, we would love to sort of introduce that functionality. But of course, one of the challenges about introducing CO2 is not only introducing the right amount of CO2 to balance what exactly you want to show, but it's also the amount of CO2 required that would need to be included in each breath. But we're definitely looking at CO2, but our options right now are simulated, so the LEAP patient monitor, or we can use the VitalsBridge for that.
There's a question about heart and lung sounds. I think we briefly touched upon it, but yes, any changes to that, or does it affect the sounds in any way?
No. So as we know, SimMan 3G Plus has sounds anteriorly and posteriorly, and of course the lungs are, or the advanced lung module is within the chest, and of course they're pistons that move up and down. So one of the things that we needed to make sure that we did when we designed this product, that we didn't have mechanical noise that's in there. So no, you still have the lung sounds, you still have the heart sounds. They're both available anterior and posterior. And of course you can control the volumes and obviously the different sounds parameters, but the advanced lung module doesn't affect the use of sounds or your ability to hear them.
Good. Okay, so last question I see on this list per now. So any changes to the software integration or how the functions are controlled?
Yeah, so effectively the way that the lung module is controlled is very similar to the way the ASL 5000 is controlled. So it's used with a plugin. So this is a software version that sort of sits within LEAP. I guess the key difference is that the actual software appearance and the way that you control the parameters like resistance, compliance, and muscle pressure, all of that, it remains exactly the same. The one thing that's different is the way that it connects. So for those that are familiar with the ASL 5000, once we have the ASL 5000 connected to the simulator, we actually connect to that independently. So once we are connected to the SimMan, then we connect to the ASL 5000, and this is done via serial number. The big difference with the advanced lung module is because that's a part of the simulator. When we connect LEAP to the simulator, we also connect to the advanced lung module. So therefore, when you're driving it, you'll be driving it as the same as the ASL 5000. So you have your simulator functionality. You also have the plug-in functionality, which allows you to control the lung. But it's really just the connection that is the difference.
Good. Okay, I think that's all the questions we have time for today. And if we didn't get to your question, we will follow up with you after the showcase. Just a reminder, there's a number of resources available for you to access by using this QR code that you see on your screen.
So thanks very much for spending time with us with our What's New in Simulation showcase, where obviously we featured the SimMan Critical Care. Take care. Bye.
Wow, thank you, Danny and Carl Rubin. This presentation has been really impactful, and I loved some of the questions and answers that they provided. We're now going to answer some of our questions that we have here in North America. So our first question is there any lost functionality between a SimMan 3G Plus and a SimMan Critical Care? And I'm happy to report that the answer is no. You lose no functionality from a SimMan 3G Plus to a SimMan Critical Care. So all of the things that you love about the SimMan family, like neurological response, sweating, bleeding, advanced airway, with SimMan 3G Plus, again, you have articulating arms, the practice like we practice with live shock and other functionalities. And most importantly, you do not lose any of the quality CPR function and feedback. So we're happy to report that no, you do not lose any functionality by going from a SimMan 3G Plus to a SimMan Critical Care. You only gain with the advanced lung module. Awesome. So our next question, Bruce, I'm definitely going to need your help on this one. So our participant is asking, how do you use a weaning protocol with SimMan Critical Care?
Thanks, Tracy. SimMan Critical Care perfectly supports weaning protocol because, of course, our ultimate goal as respiratory practitioners or anybody that's managing a ventilator is to have the patient extubated or weaned to extubation. So SimMan Critical Care obviously can support most modes of mechanical mandatory ventilation, including the addition of PEEP and things like that. And then as the patient becomes more able to support their own breathing, SimMan Critical Care actually creates negative inspiratory pressure at the mouth because of the nature of the internal lungs. So the internal lungs are basically like pistons, so that when they descend, as the simulator takes a breath in, it creates negative pressure, which is detected by the ventilator, which will then, if it's set up to do so, provide support to the patient. So all that to say, yes, SimMan Critical Care perfectly supports weaning protocol exercises. Thanks for the question.
Yeah, and so just to tag team on what you're saying, Bruce, is that so any pressure support mode of the ventilator can support that weaning process. And then we can use some of the functionality of the simulator, like trismus and eyes half open and other things like that, to simulate kind of that waking up or that weaning process. Is that correct?
That's right. Thanks, Tracy. Yep, no functionality is lost when we look at SimMan 3G Plus versus SimMan Critical Care.
Awesome. Okay, so we're going to take another question. This is a great question. Is there a way to represent different demographics of patients? So that's a great question, like nursing and simulator. So yes, we actually have the ability with SimMan 3G Plus and SimMan Critical Care that we have interchangeable head skins. So those head skins have the ability to have a geriatric patient, so an older patient, we can change that demographic. We also have the ability to have a female head skin that is very easily, it's a zip up the back and a couple small lure lock connections for the fluid system to change those head skins. We also have a female vest that you can also have to kind of change the demographic of the chest and the genitalia for both SimMan 3G Plus and SimMan Critical Care. So that is a great question. Yes, you do have the ability to change the demographic of your patient to be able to represent and train different types of patients. So unfortunately, we are running out of time. So again, continue to monitor the Q&A chat function. We will continue to answer questions. I really wanted to thank everyone for being here and your time, but I wanted to give it over to Bruce for any other last minute kind of key takeaways.
Oh, yeah. Thank you, Tracy. So for me, really, again, I'll say it again. This is a situation where we're ventilating to the condition of the patient, not to the limitations of the simulator. this is as realistic a training solution as I've ever seen with regard to ventilatory management. I believe that SimMan Critical Care will advance critical care training and will also be a very useful tool for folks that are responsible for taking care of patients that require ventilatory support. So that's my key takeaway, is the realism of the solution. How about you, Tracy? What's yours?
Yeah, for me, SimMan Critical Care just has the ability to really help train and represent every respiratory and critical care illness, from that first responder, that patient that has COPD and is calls 911, is having trouble breathing, all the way through the continuum of care, through the ER, through the OR, and the ICU. I just think it is such a valuable tool, and I am confident and excited to see how SimMan Critical Care is going to continue to help drive our mission of helping save more lives, one breath at a time. Again, thank you to everybody for sharing a piece of your day and time with us. If you have any questions, I will drop my email address into the chat. And of course, don't forget to always access Laerdal's website, laerdal.com. Thanks again, and thank you for being our partners in our mission of helping save lives.